Hi! For my project, I researched Mary Ainsworth, one of the major contributors to attachment theory. Mary Ainsworth was born on December 1st, 1913, in Glendale, Ohio, to Charles and Mary Salter as the oldest of three daughters. The family relocated to Toronto in 1918, and in the fall of 1929, Ainsworth enrolled in the University of Toronto. There, she earned a bachelor's in psychology in 1935, a master's in 1936, and a PhD in developmental psychology in 1939. Ainsworth went on to become a lecturer in the psychology department until 1942. She then joined the Canadian Women's Army Corps during World War II. Here, she administered psychological tests, counseled, and recommended placements for Army personnel. Ainsworth returned to the University of Toronto in 1946 and taught introductory and experimental psychology courses, as well as wrote a book for students further explaining the Rorschach technique. In 1950, Mary Ainsworth married Leonard Ainsworth, a master's student at the University of Toronto. They moved to London, where Ainsworth began working at the Tavistock Clinic, researching maternal separation from children in early childhood, with Dr. John Bowlby, one of the founders of attachment theory. She worked at the Tavistock Clinic until 1953, where she familiarized herself with Bowlby's early attachment research. In 1953, the Ainsworths traveled to and lived in Uganda for a period of time. Here, Ainsworth designed the first empirical research study on attachment. She observed 26 babies in a naturalistic setting, aged 1 to 24 months, every 2 weeks for 2 hours over the course of 9 months. Ainsworth took particular note of the onset of the baby's proximity-promoting behavior to their mother, meaning when the baby began to purposely orient itself to the mother. This research closely examined differences in the quality of mother-infant interaction, a topic that was previously thought to be too difficult to study. This research allowed Ainsworth to observe 3 distinct attachment styles: secure, insecure, and not yet attached. Secure babies explored their environment when the mother was present. Insecure babies cried frequently, even when they were held by their mother, and explored little. And not yet attached infants demonstrated no differential behavior to their mother. In 1961, Ainsworth returned to the United States and continued her attachment research in the renowned Baltimore study. She recruited 26 families during the prenatal period for this study and began making home visits before the child was born, forming narratives for each family. Ainsworth carefully observed mother-infant interaction in the first 3 months and found that maternal sensitivity in the first months of life was correlated with more harmonious mother-infant relationships in the last months of the first year of life. As part of this study, Ainsworth designed the strain situation as a standardized way of examining attachment styles in 1-year-olds. The procedure begins with a mother and baby entering a laboratory playroom and beginning to play. They are joined by a stranger who begins to play with the baby. During this time, the mother leaves the baby and the stranger alone together. Mother then returns, and the stranger leaves mother and baby alone together once again. Mother then leaves the room for a second time, and baby is left completely alone. The stranger then returns to the room and attempts to engage with the baby, and then, finally, the mother returns and the experiment is over. Common misconceptions of those not familiar with the strange situation may be that Ainsworth was studying the baby's behavior when the mother was present versus when the mother was absent, how the baby reacted when their mother left the room, or how the baby interacted with a stranger. However, Ainsworth predicted that the baby would explore the playroom more in the presence of mother than the stranger, and be distressed when the mother left the room. What she was really interested in was the baby's behavior during reunification. Ainsworth observed 3 patterns of behavior during reunification: secure, insecure avoidant, and insecure ambivalent. The group of babies that demonstrated secure attachment were able to be comforted after a few moments when mother returned, and quickly resumed their exploration of the room, using their mother as a secure base. These babies have been able to get their needs consistently met by their mother and feel safe and secure in the relationship. The group of babies that demonstrated insecure avoidant attachment did not seek their mother out for comfort when she returned, despite the fact that they may have searched for her when she left. These babies have had their needs consistently not met by their mother because their mother is unavailable or rejecting. The avoidant attachment style allows these babies to maintain a proximity to a mother that may reject them, because actively seeking their mother out may result in dismissal. The third group of babies that demonstrated insecure ambivalent attachment appeared to be angry when mother returned. They displayed a desire for contact with their mother by pulling her closer, but would then push her away when she held them, displaying ambivalence. These babies have had their needs inconsistently met by their mother. Mothers of these babies are unpredictable, therefore, the baby attempts to maximize their efforts to maintain proximity to their mother and appears clingy. A fourth attachment style called disorganized attachment was added later. This attachment style is characterized by a lack of a consistent strategy to bond with mother and is typically the result of trauma, abuse, or neglect. So this is an example of a secure attachment style on video. So we see the stranger entering the room and reading a magazine. And here we see the stranger is attempting to engage with the baby by playing with it. And then we see mother getting up to leave the room. And we see the stranger go over there to try to comfort her. Yeah, and we see her going over there trying to comfort her. And then mother returns to comfort the baby. And we see that the baby is allowing herself to be comforted and that the reunification is positive. Then we see mother and baby playing together once again. The stranger's loved. And the mother's engaging. Then we see the mother leaving the baby alone. Again, the stranger's not in there. And the mother is leaving the baby all alone. Baby's very upset. And then we see the stranger return and try to comfort and engage with the baby, really to no avail. We see the mother return finally, and the stranger's left them alone, and the mother's comforting the baby, and she's allowing herself once again to be comforted. So this is the reunification. There are several strengths and weaknesses regarding the strange situation. This experiment was the first to empirically study attachment styles, something that was previously only theorized about. The experiment is also high in internal validity because Ainsworth was able to tightly control for any extraneous variables. However, this means the strange situation has low external validity, meaning that the findings may not necessarily apply to a real-world setting with confounding variables. The strange situation has also been able to be replicated multiple times with very similar findings, increasing the reliability and the validity of Ainsworth's original results. One major shortcoming of the experiment, however, is that the original strange situation only examined 26 American mothers, completely excluding other countries, cultures, and caregivers. Additionally, infant attachment styles may only partially or not at all determine childhood and adult attachment styles. A baby that is securely attached is not necessarily destined to only develop healthy and intimate relationships, just like a baby that is insecurely attached is not doomed to only develop challenging and problematic relationships. There are mitigating factors that occur throughout childhood, adolescence, and adulthood that impact our attachment styles. A trauma can negatively impact an individual that was a securely attached baby, while therapeutic intervention can positively impact an individual that was an insecurely attached baby. So, how can we apply this to social work? It is important that social workers understand how attachment, both in infancy and throughout the lifespan, impacts not only our clients, but ourselves as well. It can aid in our own formulations and help us to educate our clients about their relationship patterns and any interpersonal issues that they may experience. It can also help us trace relationship styles throughout a family system so we can see any intergenerational patterns that may have formed. If we are working with parents of young children, it may also allow us to perform necessary interventions if we recognize an insecure or disorganized attachment style may be forming. By understanding what these different attachment styles look like and what parenting behaviors allow them to form, we may be able to educate or assist the client in healthier parenting techniques and that promote more secure bonding between parent and child. And these are my references. Thank you all for watching.